Welcome to today's COVID-19 update. Today we have Dr. Deena Hinshaw, Chief Medical Officer of Health for Alberta. Dr. Hinshaw.
Thank you, Chris, and good afternoon, everyone. Over the last 24 hours, we identified 442 new cases of COVID-19 and completed about 7,700 tests. Our positivity rate was about 6%. There are currently active alerts or outbreaks in 242 schools. Of these, 2 schools had 10 or more COVID cases who attended in the last 14 days while infectious. There are currently 836 people being treated for COVID-19 in hospital, including 183 in the ICU. Sadly, over the last 24 hours, 12 new deaths have been reported to Alberta Health. My thoughts are with the family and friends of these individuals. Their deaths are a painful reminder of the serious outcomes this virus can cause for people of many different ages, backgrounds, and health conditions. We are incredibly fortunate to have an effective and widely available tool to prevent the vast majority of these serious outcomes. The benefit of vaccines is clear in the numbers that we post online every day. For example, in the last 3 months, people over 80 years old who weren't vaccinated were 12 times more likely to die from COVID than those who were fully vaccinated. The protection further improves when we look at younger groups. For example, unvaccinated 70 to 79-year-olds were 52 times more likely to die from COVID in the last 3 months than those who were fully vaccinated. If you haven't already done so, please get fully vaccinated to protect yourself and those around you from COVID-19. The science is clear. Vaccines work, they are safe, and save lives. If you have any questions or concerns about COVID vaccines, I encourage you to speak to your family doctor or a trusted other primary care provider. They know your personal medical history and can provide trusted advice when it comes to vaccines. If you don't have a family doctor, you can visit albertafindadoctor.ca to find a physician in your community who is accepting new patients. For those who are fully vaccinated who want to support and encourage those who are not to look at reliable evidence while making their decision, I ask you to remember that everyone has different reasons for not having accessed vaccine yet. It's also important to remember that good decision-making is hard to do when we are in a strong emotional state like anger or fear. So whether we are fully vaccinated or not, the more we can listen respectfully to each other without anger, the more possible it is to open space for ongoing dialogue and understanding each other's perspectives. As this dialogue happens in the province, it is encouraging to see that since launching the provincial restrictions exemption program in mid-September, we have seen a significant increase in vaccinations. In fact, more than 505,000 first and second doses have been administered over the last 6 weeks. As of yesterday, full vaccination is required to access any business, venue, or service participating in the restrictions exemption program. This means you'll need to have received your second dose at least 14 days before you enter the facility, and you need to present valid proof of vaccination at the time of service. There was a transition period when 1 dose was accepted. This was done to give Albertans the opportunity to get both doses before requirements changed. Those who are not fully vaccinated can still choose to provide a privately paid negative COVID-19 test from within the previous 72 hours or valid proof of a medical exemption. If you only have 1 dose, I urge you to get your second one as soon as possible. The data shows that 2 doses are much more effective at protecting you from COVID-19 and in particular from the Delta variant. In Alberta, we have seen that receiving 1 dose of vaccine offers 57% protection against the Delta variant that is currently circulating. With 2 doses, the protection jumps to 89%. By getting a second dose, you not only gain access to the businesses and services participating in the restrictions exemption program, you also increase your protection against the virus. Getting a second dose helps protect you, your loved ones, and your community. Finally, I want to remind Albertans that tomorrow evening I will be hosting a telephone town hall to answer questions about vaccines, fertility, and maternal health. I'll be joined by Dr. Eliana Castillo, Clinical Associate Professor, and Dr. Verena Currett, Head of Maternal Fetal Medicine, both from the University of Calgary's Department of Obstetrics and Gynecology. Dr. Castillo is a leader on vaccination in pregnancy, and her medical and academic practice focuses on reproductive infectious diseases. Dr. Currett is a maternal fetal medicine specialist, and her research focuses on reproductive infectious diseases and its impact on maternal and fetal health. Her clinical practice includes inpatient and outpatient management of high-risk pregnancies. The town hall will take place from 6:15 to 7:45 p.m. tomorrow and is open to anyone interested in the topic. If you'd like to attend, simply register online at alberta.ca/townhall by noon tomorrow, and you will be sent the dial-in details. I look forward to answering your questions on this important topic. Thank you, and I'm happy to answer questions today.
Thank you, Dr. Hinshaw. We do not have any reporters here in the room today, so we'll be going exclusively to the phones. Operator, can you put through the first caller, please?
Dylan Short, Post Media.
Hi, Dr. Hinshaw. This may be more a question for AHS, but we've heard that, with hospital numbers coming down, they're starting to look at ways they can maybe reduce some of the surge bedding and put resources towards other parts of the healthcare system. I was wondering if you could shine any light on how this may be done, what areas may be prioritized, or if there's different regions of the province that may be prioritized as numbers come down, or if there's just general information of how this might be done.
I'm afraid I don't have the details of that, so you're right that AHS would be better positioned to be able to give you more information. It's my understanding, of course, as you say, that they are continuously adjusting to meet Albertans' health needs from all health conditions, but they would be better positioned to provide you with the details.
Dylan, do you have a follow-up?
Yeah, I do. On a different note, there's been some reports in the media today of different health experts talking about a potential for a fifth wave of COVID based on low vaccination rates in different areas of the province. I wanted to get your reaction to this, and if you wanted to add anything more to, the fact that while Alberta does have a pretty large population that is now first or second dose vaccinated, there are still pockets of the province that do not have the greatest uptake.
It's clear that we will not be able to eliminate COVID-19 either in Alberta or around the world, so we will need to learn to live with COVID-19. Anyone who is not fully vaccinated is almost certain to be exposed to COVID-19 at some point in the future if they haven't already been. And so it's another reason why for those who haven't been exposed yet, now is the perfect time to get the protection that vaccine offers. How that will look in terms of the timing of infections or how quickly those infections are grouped together will really depend, again, on how we work together as a province. It's why we continue to have public health measures in place, because our acute care system is continuing to be under significant strain, even as our numbers come down. We're sitting at about the same number of COVID patients in ICU right now as we had at the absolute peak of our third wave. So even though it's encouraging to see numbers decline, again, that's why we're really needing to focus on protecting each other, both through vaccine and measures. And what a fifth wave might look like, or how COVID will unfold in the future, again, depends on multiple factors, including how many of us take the advantage of vaccine protection, including whether or not there are different genetic variants that emerge of COVID and how that interacts with the vaccine. So as we have always done, we will remain vigilant and watch the evidence and respond accordingly wherever there are needs to adjust our approach.
Operator, please put through the next caller.
Quinn Oler, Global News.
Hi, Dr. Hinshaw. Just wondering, there was a lot of concern over Thanksgiving long weekend with the numbers we are seeing now. Is this our first successful long weekend that we've seen through COVID?
It's encouraging to see that the numbers have continued to decline. There is one small caveat, I'd say, that we know that any kind of significant event like Thanksgiving causes two kinds of challenges. So the first is the transmission that might occur on that long weekend specifically, and we're definitely past the time where we would see that direct impact of Thanksgiving. But what happens in a secondary way is that if there are significant spreading events on that particular date or on that weekend, it could potentially cross into multiple networks. And so sometimes we see a secondary impact. And right now we're kind of at that point in time where we're monitoring for that secondary impact. Again, encouraging to see our positivity rates continuing to decline. However, it's still really important to keep vigilant, to celebrate that we haven't seen a significant bump so far, but ultimately we know there's still a lot of COVID out there and we do need to maintain caution still.
Quinn, do you have a follow-up?
I do. Some provinces are giving timelines on when restrictions will be lifted, like proof of vaccination and masking. Do we have a timeline or a metric on when we could see restrictions lifted here?
I think the most important consideration when we're contemplating when we might be able to ease some of those measures is really looking at, first of all, our acute care system and knowing that right now we are still under very significant strain. It's much too soon to contemplate easing because we really don't have the capacity to take any more surges in acute care admissions right now. The second thing is, again, to continue to watch the data as it unfolds. And so as we come down the other side of the fourth wave of the Delta variant, we will make the best decisions we can. We always seek to balance the direct impacts of COVID against the indirect impacts of restrictions. And yet I think it's very challenging to predict over the next 6 months. Again, there may be a new variant that emerges. There may be other kinds of circumstances we need to respond to. So I think the best approach is really to monitor emerging data and evidence and make the best decisions in the particular context that we're in without setting a date far down the road where we don't yet know what the circumstances will be like at that point in time.
Operator, please put through the next caller.
Matt Woodman, CTV.
Hi, Dr. Hinshaw. An expert panel voted overwhelmingly to recommend that the U.S. Food and Drug Administration authorize the Pfizer vaccine for kids ages 5 to 11. I was just hoping to get your thoughts on this and whether this pushes us any closer to getting kids in Alberta vaccinated against COVID.
As you know, every country has their own regulatory system for medications, which includes vaccines. And so this, as I understand it, is a part of the US's FDA approval process. We are waiting for the results of Health Canada's assessment of the pediatric vaccine, and we rely on their robust assessment of safety and efficacy to determine whether or not a vaccine is able to be offered in Canada. We are making plans so that we are ready if at a certain point in time that all of those high bars for safety and efficacy are met and Health Canada does approve it for use in Canada. We are making sure that we would be ready when that happens, so there's not a delay. But again, it's really important that all of those steps be followed in the process so that that safety and efficacy, we're confident in that before it's available to children in Alberta.
Matt, do you have a follow-up?
I do. This might be a question for the province, but I'm just curious. Back on October 20th, that it was announced that parents could pre-register their kids for a first dose if and when it is approved by Health Canada. I was just wondering if you know how many parents have pre-registered their kids for this.
I'm sorry, I don't have that information at my fingertips, but we can follow up and get that.
We'll check into that, Matt, for you. Operator, can you put through the next caller, please?
Matthew Conrad, Global News.
Hi there, good afternoon. Dr. Hinshaw, BC announced today its plan to provide booster shots for anyone who wants one 6 to 8 months after their second dose. Do you know what the province's plans for third dose rollout to Albertans are and what's the latest evidence you have on booster shots?
The question around booster doses, that third dose after initial primary series, is one that we have been making a lot of progress on in Alberta by high-risk groups. So as you know, we've been working with our Alberta Advisory Committee over the past several months to follow the evidence closely and to make vaccine available to those groups who are at the highest risk of severe outcomes should they have a breakthrough infection. So this is something that we've been following closely and making recommendations, or asking our advisory group to make recommendations to us in terms of the policy in Alberta. We understand that there's a National Advisory Committee on Immunization recommendation on booster doses that would be coming out relatively soon. We'll be discussing that with our Alberta Advisory Committee, and again, wanting to make sure that we're following the best emerging evidence and the available information on boosters. We know that the vaccines, especially given that in Canada, the majority of the vaccines that have been offered have been given at a slightly longer interval, which does increase the overall effectiveness of vaccines. We know that vaccines continue to offer very high levels of protection against severe outcomes for the vast majority of people who have received that primary series. So we want to make sure that we're, again, following the evidence closely. We anticipate in the next several weeks we will have the benefit of the National Advisory Committee and our own advisory committee's next set of recommendations, and we'll keep Albertans informed as anything changes on that front in terms of eligibility.
Matthew, do you have a follow-up?
I do. Just wanted to find out where things stand on the Johnson & Johnson vaccine being made available to Albertans. I know this is something that the Premier spoke about a few weeks ago. Just wanted to find out where things stand on that front and if it's still planning to be rolled out, I guess, primarily to the areas in rural parts of the province.
Sure. So we have been working with other provincial and territorial partners who are also interested in having a supply of the Janssen vaccine. So working with the federal government, who ultimately does the work on procuring and obtaining vaccines for the country. So I don't have a specific date on when vaccines will be available, but as soon as we are able to work through that process to get vaccines into Alberta, then we will let Albertans know where they can access vaccine. And when it's available, anyone who would choose to take a Janssen vaccine as their preferred option would be able to access that. And again, we'll have more information when the vaccine is available about where people can access it.
Operator, please put through the next caller.
There are no more questions in the queue today.
Oh, thank you. All right, everyone have a good afternoon, and we'll speak to you again soon. Thank you.